News Channel, Peter Doocy has gotten hold of a couple of Republican senators in the hallways of Congress and asked them about last night's health care failure. He gotten hold of Senator Bill Cassidy, who says, "We're still playing through repeal." What that means, I have no idea whatsoever. Playing through repeal. Meaningless, utterly meaningless. He then got hold of Senator Rounds, Republican from South Dakota, who honestly says, look, this makes repeal very difficult. That is hurting the country. So there is absolute confusion in Republican ranks. Indeed, they are fighting each other, bearing in mind that last night the repeal bill failed. The plan now is to submit a flat-out simple repeal bill soon, pass it, and then not put that repeal into effect for 2 more years. In other words, virtually no matter what happens, we are stuck with Obamacare and a collapsing system. What does that mean to you? Let's bring in Dr. Marc Siegel on this health care reform failure. Okay, let me spell this out again. I mean, just for the benefit of viewers. We're stuck with Obamacare no matter what for a couple of years, and it is collapsing. Now, if I'm a person who's getting Obamacare coverage, what happens to me?
It's getting worse and worse, Stuart. First of all, the big picture, 47 counties in the United States by 2018 will have no insurer to choose from. 1,200 counties, you will only have one. So that's called a monopoly. And the price, the premium you're going to have to pay is exorbitant. The subsidy the federal government is giving is a lot. The deductibles are higher and higher. Here's what that means in the doctor's office. You'll walk in to see me. I say you need a thyroid scan. You say, well, wait a minute, I haven't met my deductible, and I can't afford to pay for it. That puts the doctor in a terrible position where he wants somebody to get some care that they can't get. Then I go to look for a specialist, and I find no endocrinologist is taking that Obamacare. Really narrow networks. Doctors are bailing out. They're running away from it. Hospitals are running away from it.
Well, doesn't this just shove everybody into Medicaid? Doesn't everybody claim, look, I'm poor, I can't afford this, give me Medicaid? Isn't that what it does?
Well, certainly that does do that up to 138% of the poverty line in expansion states. And you know what that does? That's your favorite word. It's a job killer.
Okay,
it's a job killer. You have Medicaid, you say, you know how many patients say to me, I can't give up that Medicaid? I can't take that job because I'm going to lose my Medicaid?
You know what, Doctor, let's be honest here. If I make more than, and I'm not qualifying for Medicaid, and I've got Obamacare coverage, I am literally up the creek. I don't have coverage. There's nothing I can do, is there?
Absolutely
is there?
not. Absolutely not. There's a big donut hole there.
I mean, I don't know how many people, hundreds of thousands of people are left high and dry, right?
Hundreds of thousands of people are left high and dry. The only place they can go to are free clinics that the feds provide, which cost a lot of money. If a patient has Medicaid, by the way, it doesn't mean they can find a doctor who takes it. It doesn't mean they can find a provider that will provide the test that they want. They have a great entitlement with Medicaid, but it doesn't always give them the care that they need. And that's what I've said from the beginning. The same thing is true with Obamacare. You could be left high and dry with a deductible you haven't met, with a premium you can't afford, with a doctor that's no longer taking your insurance.
In my opinion, this is flat out irresponsible. And you say?
I say that the whole discussion has centered on the issue of health insurance when it should have centered on the issue of health care. Yeah. How do you get taken care of? Where are the doctors to take care of you? Where is the treatments? As you and I talk on the show all the time, we're talking about high-tech medical solutions that are very exciting, that are coming down the pike. Insurers aren't going to cover those. Obamacare definitely not going to cover those. So you're going to end up with treatments that the insurance you have, this terrible insurance you have, won't cover, even as it charges you a premium you can't afford. That's the future right now for the next 2 years.
It is outrageous.
By the way, they should have made a deal, and I've said this all along. I love the Cruz Amendment because there would have been more catastrophic choices. I wish they had made a deal on Medicaid. That would have maybe brought the moderates in.
I wish. Doc Siegel, thanks for joining us on a very poignant day.